Okay, it looks like it's 3:30, so we'll go ahead and get started for today's COVID-19 press briefing for the Quad Cities. My name is Brooke Barnes, and I am with the Scott County Health Department, along with Nita Ludwig, Administrator of the Rock Island County Health Department, and Ed Rivers, Director of the Scott County Health Department. We also have with us Dr. Doucette, Chancellor of Eastern Iowa Community Colleges, and Craig DeVrieze, Director of Communications at St. Ambrose University. So these partners from our community's institutions of higher education are joining us today to share their planning and precautions that their institutions are taking to prepare for the academic year during the COVID-19 pandemic. So we're very grateful that they're joining us today. We'll go ahead and get started with prepared statements from each of our speakers. Please feel free to type any questions that you have into the chat. We will get to the Q&As at the end. And if your question is for one of the panelists specifically, please type their name in as well. So Nita, can you please start us off with the numbers for Rock Island County?
Sure. So today in Rock Island County, we are reporting 11 new cases of COVID-19, which brings our total to 1,491 total cases. And our deaths do remain at 30 at this time.
In Scott County, as of 3:30 this afternoon, our case count stands at 1,499, and our number of deaths remains at 11. Since entering our community earlier this year, COVID-19 has created challenges, roadblocks, and difficulties for our community. None of these may be more complicated than those to the Education Center. We invited area institutions of higher education to join us today to describe the actions they're taking to prepare for learning for the 2020-2021 academic year. We're joined by St. Ambrose University and Eastern Iowa Community College. Thank you for being here and sharing with our community how you're overcoming these challenges.
First, we'll hear from Dr. Doucette with Eastern Iowa Community Colleges. Please go ahead, Dr. Doucette. Can you unmute yourself?
Just to remind folks, the Eastern Iowa Community Colleges is a family of colleges across 5 counties. Our principal campuses are on Clinton Community Community College, Muscatine Community College, and Scott Community College. We closed in March and we reopened for our summer term to provide in-person instruction and services to students for the summer term. We gradually reopened following the best guidance available from all of you, the public health officials, and we had a very positive summer. Students welcomed to return to campus and in-person instruction and services. Our faculty and staff reported feeling safe on campus as a result of the health and safety measures we implemented. And both the students and employees complied nearly universally with recommended behaviors that we focused on, which included mask wearing and social distancing, as well as best practices of respiratory health and cleaning and disinfecting both private and public spaces. And we had a very positive summer, very few experiences with the virus. Now, we're right now applying what we learned during the summer, and we always intended it as a pilot to the fall term. And again, the strong emphasis is going to be on proper mask wearing and social distancing, and including training on best practices in these areas for our students and our employees, and monitoring and enforcing those behaviors on campus. One of the things that we're doing in the fall that will be an enhancement to things that we did in the summer is starting a drive to get students and employees to sign a pledge that they are, by their behaviors, they'll support the health of our communities, not only on our campuses, but also in their life on and off campus. And that's essentially to focus on the importance of wearing a mask properly, and in social distancing themselves when it's necessary to do so. We're of course doing many of the things that we're enhanced the cleaning of our classrooms and the spaces that we have, but mostly we're focused. But the big emphasis, I have 17 things in front of me here that I could list of the practices, but we're focusing on our employees and their behavior, and their training and their commitment to each other, to practice the behaviors that we know make a difference in containing the virus. And so we are offering our students choices about the classes that they take and the delivery modes. We have always had a reasonable number of online courses. We're part of a big consortium, and a third of our students are often online students. And that's up a little bit this term. We are also offering a version of online that includes synchronous Zoom classes so that they're face-to-face but still remote. And then we're also offering courses on campus, especially those that require on-campus hands-on training, laboratories, things like that, but others as well, because we know that some students learn and need to learn with in-person instruction. So the numbers are incomplete right now. We have a number of students still to register for our classes. We will probably have a half to 2/3 of our students online and a third or more of our students on campus. We believe that we continue to offer on campus because we really believe we can provide a safe environment. Our classrooms have been socially distanced, 6 feet apart or more, with reduced capacity in all of those classes. All kinds of plastic plexiglass shields for frontline staff, disinfectants and hand sanitizer all over the place. Everybody picks up a wipe on the way into a class and wipes down their desk. And we make sure that our faculty are going to be very careful about taking attendance and noting that the students are wearing masks and have done that throughout and socially distanced throughout the period, so that if a student ever would come back to us with a report of having been positive, we would know what the conditions in that classroom were like when that report was traced back to a class. So we're committed to the health and safety of our students and our staff. We wouldn't be opening if we didn't believe we could provide a positive and safe environment. We demonstrated this summer that we can, and we fully expect to replicate that success in the fall. Of course, we'll carefully monitor and respond to any changes in the condition and community health. But we believe our commitment to achieving compliance and support for our measures is the key to our success going forward. I hope that wasn't too long.
No, that was great. Thank you so much for sharing your experiences so far, and we're wishing you the best of luck in the fall term. So next we're going to go to Craig DeVrieze, Director of Communications of St. Ambrose University. Please go ahead, Craig. Can we get you to unmute yourself, Craig?
I say on our WebExes, we need a Garrett Morris in the corner yelling out what we say.
We got you now. Thank you.
St. Ambrose has been pretty busy since May, figuring out the ways, the things that we need to do to reopen the university, bring back our students for face-to-face classes in August. We formed a task force, and beyond the task force, they turned in a 74-page report to the president and her cabinet. We have formed an implementation team that has worked through all the permutations of social distancing and getting residence halls ready to welcome students back. We brought in an architect and also a furniture vendor to look at our classrooms and help us achieve the social distancing and the spacing that we need in order to be to observe the CDC recommendations. And much like the pledge that that EICC schools will be requiring, we are introducing the Be Safe, Be Responsible pledge, promise, excuse me, the Be Safe, Be Responsible promise. And that's B with 2 E's because that's how we do. We're the Fighting Bees. So our plans are to reopen on August 17th. That's a Monday. That's 1 week earlier than originally scheduled. Our hope is to, like a lot of schools in the Midwest, is to get in front of the flu season. So we'll open on the 17th and we'll conclude on November 24th the portions of our in-classroom studies. And then we'll take finals online through December 4th. And we have our classes, most of our classes will be delivered in a hybrid format, which means that we're basically cutting the enrollment in half. Half of the students will take a class on a Monday in person, and then the other half will be observing online, and then the following day they'll switch places, and that will help us achieve the social distancing that we need in order to stay safe. And the Be Safe, Be Responsible pledge will require all the behaviors that the CDC recommends, specifically face coverings, the social distancing, and the safety behaviors. We hope to encourage our students to practice away from the classroom and within their residence halls as well. We also have we're negotiating through a memorandum of understanding with the area provider. We'll have testing readily available, ideally on campus. We also will, we make the available to students an opportunity to learn strictly online, to stay home and take advantage of as many of our online offerings as they can. This is an expanding menu specific to the current situation, and we hope that students who don't feel like they want to come on campus will take advantage of that and work to complete their degree through this rare and strange semester. With one exception, our residence halls, it will be, we offer suite and apartment style living. So the fact that we were able to bring students back to live on campus was accommodated by the fact that for the most part, students will share bathrooms with only 3 roommates. And we ask that they be very vigilant about cleaning up their living space, and also like EICC, like Dr. Doucette mentioned, they are going to be asked to clean their learning spaces as well as best we can. We've made accommodations in our cafeteria to allow students to have meals to go. And also we have removed the buffet style dining that we've often, that has been kind of a hallmark of residence hall living and the college experience for a number of years, to remove the touch points. Students will be served their meals, and again, within our cafeteria, we also will observe social distancing. So as is the EICC, our cabinet is very closely monitoring current trends, and we will be ready to respond should the cabinet deem that warranted, to go back online only as we have in the past. But our hope and our intention, and the stated desire in surveys that we issued to students earlier this summer, and their parents, by the way, was for face-to-face learning and to experience as much of the college on-campus experience as the current situation will allow. So that is that's what we've been working toward since May, and August 17th, we'll be ready to go.
Thank you both so much for sharing these plans, and again, the unique challenges that you both have with your campuses and the diversity of students that you're welcoming back. So we appreciate all of your work to work with us on plans for that, and hope we can continue to support you in that. We do have a couple of questions, and we encourage any of the media on the call, if they have additional questions, please type those in. The first one, and this is for Craig, and you already did touch on this. I don't know if there's anything else you want to highlight, but what is St. Ambrose doing to help students distance from each other in dorms? You mentioned a couple of the things. If there's anything else you want to underscore there.
Yeah, I would underscore that, kind of referring to the second question. Yes, students are required in group settings to wear masks, certainly in classrooms to wear masks. That's definitely part of our requirement. We require social distancing. We require safe hygiene practices and a number of other things. The promise is the promise. There's a process they'll follow to check off a checkbox that shows they've read the promise and commit to the promise. But there are also policies that will be enforced, not just for students, but also for faculty and staff, that will require these behaviors. And if somebody were to refuse to wear a mask, the first offense will probably be a warning. But beyond that, continued refusal will remove them from campus. And for employees, it could be a loss of employment. We're taking this all very seriously. The health and well-being of our students and our campus and our community are very much in play here. And we hope to help our students understand that being responsible in their behaviors is going to be very important. As to the question from WVIK, as to what we're doing in the dorms, students won't wear masks necessarily in their individual living spaces. But in any group setting, in any residence hall, they will be asked to wear a mask and observe social distancing. A lot of the events that we have normally will be done via WebEx or Zoom. A lot of much remains to be seen. I guess I'll field all the questions that as they come along. In regards to athletics, the plan was announced in late June that the NAIA, the National Association of Intercollegiate Athletics, would allow athletics and sanction athletics on a limited basis. There would be truncated schedules. That's being reviewed as conditions change. And currently we're waiting to hear back from the presidents and the athletic directors of the NAIA, as well as the collegiate conference, the Chicagoland Collegiate Athletic Conference. They're reviewing current situation, and we expect an announcement from them virtually, possibly any minute, certainly any day now. So we expect to know more about athletics very soon.
So we do have another question for you, Craig. Will students be able to do their entire semester online if they choose? And perhaps this is for both of you.
Yes, I'll answer that first, and then I'll yield to Chancellor Doucette. But yes, we are making as many online courses as are available are offered to students who choose not to pursue, not to come to campus and continue the pursuit of their degree. Not every course is available online, and so some students, it may impede may change their schedule toward completion. But we're doing everything we possibly can to accommodate students who choose to remain at home and learn online.
As I mentioned earlier, the Eastern Iowa Community Colleges have a long history of providing online education, and we have substantial enrollment in online, whether pandemic or no pandemic. All of our instructors are prepared to offer their course, no matter how it's initially planned to be offered, either on campus or as a remote Zoom class, or a fully online course. They're all ready to go. They're prepared to go fully remote notice. Already you can earn a degree at EICC online completely, and that wouldn't be hard in most of our cases. Most of our courses are either fully online or fully online, or online with synchronous Zoom components associated with them. And so you can go online if you want to. We're responding, especially in this case, to students who want face-to-face instruction. The other is always available to them.
The next question I'll pose to Craig, and with the caveat that we do know the State Health Department should shortly be providing some guidance on how to handle cases as they pop up in facilities such as universities and colleges. But have you guys started talking about how you would have continuity of operations if an outbreak occurred in something such as a dorm building?
Yeah, absolutely. Every conversation that we have had has had the caveat of a contingency plan that would be to if needed, to shut the whole campus down again, as we did last year, basically within a matter of days. Our students were away in March on spring break, and on Thursday, we knew quite fully that we had to go to as much online learning as we could to close as many of the residence halls as we could, other than to students who had nowhere else to go or were international students who could not return home. And so we're definitely ready to go to synchronous online learning, distance delivery of courses. We turned that switch in a matter of 3 days last year, and we know we're more practiced at that now, and we will be ready to do that if we need to be. Specific to one individual dorm, there may be the possibility that we have made for our students, we have set aside spaces for students who will need to self-quarantine or self-isolate. And we will provide online learning. We'll make sure that they get their meals, and we will monitor their health very closely until such time as they're ready to go back to class and able to go back to class. And the testing and the contact tracing are certainly part of everything we'll do here, and they're very important part of our planning and our preparation. So we can deal with a limited outbreak, and should it be larger than we feel is safe for the entire community, we'll go to online immediately for the entire campus.
There's another question for you, Craig, regarding recreational areas. Will they be at full capacity, such as things in dorm common spaces?
No, none of that will be the case. We have social distancing currently in our wellness and recreation center, just like we have set up our classrooms with the assistance of an architect and a furniture vendor, office furniture vendor. We have relied on expertise to set up our weight rooms and our workout facilities to accommodate social distancing as well. So there's no full capacity in our workout facilities.
And Dr. Doucette, there's another question. How's enrollment for the truck driving program at Scott Community College? And are there any of the other programs that have become a lot more popular as of late?
I'd have to get back to you exactly on the truck driving program. It remains popular. And we've had to do some social distancing and be creative in how many people you can put in a cab together and all of that in driving, but we've managed, we have some innovative faculty that have figured out how to do that. But the enrollment there remains strong. Probably the programs that are the greatest demand right now are our health programs. The people have, our students and potential students have watched the heroes, that we have seen throughout our country taking care of other people. And that seems to motivate them our nursing program is bursting at the seams, things like that. We also, all of our career and technical education programs have become really popular, which is a really common thing to happen during a recession. Our HVAC program, our heating, ventilation, air conditioning program is already quite full. We're looking for ways to add more seats in that program. Our automotive and diesel mechanics programs are quite high. Our Our virtual reality and augmented reality applications development program looks like it's going to be strong, along with some of our computer science programs. So this is typical, again, during a recession where people say, I might have been laid off at this, but this is an opportunity to get some additional skills where I can get a better career someplace else. So those programs are doing quite well right now.
I would add, relative to our enrollment, we, as did many schools throughout the United States, we anticipated perhaps a drop, slight drop, or even a significant drop in our enrollment numbers. That has not been the case. We've been, we're a bit of an outlier in that our enrollment is actually above, in our first year numbers, is greater than it was a year ago. By dozens, I guess, is probably the safest way to put that. And our retention has continued to be strong. As the summer went on and families and students assessed the state of the coronavirus, we thought perhaps there would be more melt than we typically see in a summer. Again, that has not been the case. We've got, for the first time, I think today, we saw our numbers drop by 3, and that was, it's July 28th. So we're amazed at the passion and the interest and the determination that students and their families have to continue their educations in the face of this challenge.
We'll take this last. Go ahead, please. Sorry about that. Go ahead.
Just to add to that, our enrollments remain steady from last year. They were actually up year over year in summer. And we started off way behind in fall because we lost a lot of the registration periods in March and April that would normally, but we've made up all of that difference, and we still see more and more students, coming to their hometown college. Is really, this is in some cases not the time where people are comfortable going away, especially have to get on an airplane to go off to a distant university. And so, and maybe Craig, your classes are, you're also a hometown for pretty close, we
certainly have seen that, Chancellor Doucette. We've seen our transfer numbers are much stronger than in a typical year.
Right.
We have a lot of commuter students who are in fact taking classes here, whereas they might have gone away in another year.
Of course, part of that is that we have such a good working relationship with you. I think we send you a lot of our students. I believe St. Ambrose might be the #1 student and #1 institution that our students transfer to.
Certainly hope so. And we value that relationship.
Not for a second. It's close. I'm sorry. Somebody's going to correct me. I know.
We have a lot of working partnerships that I think foster that the growth of that relationship, and I think many of our programs, certainly in health sciences, complement one another. So yeah, it's been a great relationship.
There is a question here about if a person who's scheduled for in-person needs to go into self-quarantine. Do we have campus-wide attendance policies to change to accommodate that? All of our in-person class, I believe all, if not all, very close to all of our classes are Zoom capable. And so a student that would have to self-quarantine in an in-person class could simply request to be to observe the class through a Zoom connection to it. And so all of our, we've prepared for that quite well. Again, our faculty use technology all the time. They're really experts at this, and they're pretty good at delivering an alternative methods. And so we're really comfortable with that.
Yeah, and certainly that's true for us as well, is that our faculty they definitely got more comfortable with technology last spring by necessity, as did our students, but they very much do prefer the face-to-face experience. It's really kind of a strength of a St. Ambrose education, because our student to faculty ratios really work to help students get that personal instruction and that connection that kind of is a hallmark of St. Ambrose education. But I would say yes, in response to the question about self-quarantine, we do, again, we have set aside rooms where students will be able to self-quarantine should there be a need. and they can self-isolate should there be a positive test. We've also made it possible for them to go home and to continue their classes either synchronously or asynchronously if they need to self-isolate and and let the and wait for a negative test. So that's definitely part of our policy. I was a little bit negligent in not mentioning that we are relying, and the university is providing to all students and all faculty a health tracker link. And I've been using it all summer. It is an emailed questionnaire through our Health Check 360, our provider, that asks the questions that you'll encounter if you try to walk into a local hospital or medical center, or in some cases a bank. And they ask if you've been exposed to the virus. They ask if you've had a fever, if you've shown any symptoms. So that's important. And in addition to that, there's a temperature check. All students and all employees, before reporting to class or work, will be required to submit this their temperature that morning. And if in the process of that health link check, there are any red flags, the students and or the employees will be referred to a partnering health professional who will talk to them. And if testing is required, they'll definitely recommend that they get testing. And if self-quarantining is required, that they'll recommend that as well. And so this is a very important part of what we're doing to mitigate risk. And so that will be in play from the moment before students report to campus, and certainly all employees are now using that.
Well, thank you both for joining us today. That was our last question that we were able to field for you. We greatly appreciate you sharing this information and knowing the safety precautions that you have in place. And we'll look forward to, again, sharing additional guidance with you as well as with the community that comes out. So thank you to our partners who are on the call, as well as our media partners, for sharing this. We will continue to share more information with you and be on the lookout from us on our next media briefing. So thank you for joining us. Have a good afternoon.
Right. Can I ask, before you go, Brooke, you say new guidance is coming out specifically that would be pertinent to our college?